The following segment is sponsored by Citron Cardiology. Congestive heart failure is a frightening chronic condition that can last for years or even be lifelong. So what causes congestive heart failure and what are some of the symptoms? Thankfully, here today to answer these questions and more is Dr. Ben Citron with Citron Cardiology. We always love having you in studio, Dr. Citron. So let's start with the basics. What is congestive heart failure?
Well, the heart is a pump, and the heart has 4 different chambers. The 2 upper chambers we call atria, the 2 bottom chambers we call ventricle. And the chamber that we're referring to most of the time when people have a heart attack is the left lower chamber, the left ventricle. That's the one that pumps the majority of the blood throughout the body. And most people think that the heart pumps everything that comes into the chamber, and actually it pumps about 50 to 60%. About half of what comes in the chamber gets pumped out. And when we're talking about heart failure, the heart basically pumps blood throughout this interstate system, these arteries and veins in the body, and that's what helps keep you going when you play sports and do things. If that pump starts to fail, for whatever reason, the blood will back up into the lungs. And when it backs up in the lungs, then fluid collects in the lungs, and oxygen can't get into your body. And then it can't be pushed throughout the body.
Okay, what symptoms indicate that someone may possibly have congestive heart failure?
Well, the main symptom is shortness of breath. As this blood backs up into the lungs and fluid accumulates in the lungs and basically becomes very soggy. The heart's not pushing very well, the lungs fill up with fluid, and people can't breathe. And it can start slowly or gradually depending upon what the cause is. And then after that, you can get swelling in the stomach, swelling in the feet, and then some people complain that they can't sleep flat. They'll actually sleep on 2 or 3 pillows, or they'll sleep upright in a recliner. And then sometimes they wake up in the night because they're so short of breath.
This sounds super serious. What causes congestive heart failure, Dr. Citron?
The main cause of congestive heart failure is heart attacks. You know, heart attack is basically an obstruction to the blood flow to the heart muscle. So you have a pipe and something clogs up that pipe, and now blood can't get to the pump, and so the pump can't squeeze like it ought to. But there are other causes. Sometimes pregnancy can cause the heart muscle to fail, viruses, abnormal thyroid, some other abnormalities, long-standing high blood pressure can cause the heart to fail.
And then what about some stiffness of the heart? Can you explain what that is?
What that is some individuals, we call that diastolic dysfunction. And it's sort of a fancy term mainly saying that the heart's inflexible and stiff. And we think it's mainly related to as we get older, like everything else, we get a little stiffer and less flexible. The heart muscle is no different. It doesn't squeeze as well as it should. It gets a little thicker and stiffer, and so it does a great job of squeezing the blood out, but it doesn't let the blood in. And so the blood once again backs up into the lungs and makes people very short of breath.
Wow, very interesting, very informative. And next week, I understand we're going to be learning how to diagnose and treat congestive heart failure, correct?
That's the plan.
All right, well, we look forward to seeing you again, Dr. Citron. If you have questions or want to make an appointment to see Dr. Citron, check all of the information or visit their website. It's listed there on your screen. Thank you again.